Hello, it's Health with Helen, just a little bit late, stuck in traffic after teaching HIIT tonight at Corringham in Essex. So it's a beautiful evening today, yay, we're all positive today after a grey Monday, but hopefully you were a little bit motivated if you listened to my video. So tonight is just very brief, it's a bit of a Tuesday tip one, talking about the neck. In Pilates, the neck is often an area that can be uncomfortable. We can have too much tension, and I just wanted to talk a little bit about that, and also that sort of popping, cracking sound that sometimes you hear in your joints quite often in the neck. And it's just sort of really to sort of maybe stop concerns, but also to point you in the right direction if that is something that is happening. So if you are experiencing sort of as you turn or tilt your neck, maybe a popping, crunching, grinding sound, if it is accompanied with pain, then it needs a bit more attention. It would be advisable to go and see a health practitioner to see what's going on. If it is sort of every now and again, sometimes the joint can, you can get air trapped in your joints, and that can cause a kind of popping, cracking sound. And it's where maybe the synovial fluid, the pressure has changed in the joint, and you get like a gaseous bubbles that when the movement happens, it causes a bit of a popping action, which isn't necessarily a cause of concern if it isn't accompanied with pain. But if you do find this swelling or anything like that, then it's very important to go and seek the appropriate kind of health practitioner to get the right kind of attention. Now, obviously, arthritis affects our joints. And again, this sort of popping sound doesn't mean that you are going to get arthritis in your joints. As I said, it's just something where you've got a little bit of sort of that gaseous exchange going on. However, if you're constantly popping, cracking, grinding, that sensation going on, again, it might just be worth popping in to see a physio or maybe an osteopath just to check out your functionality. Or, of course, a biomechanics, which is what I do as well as the Pilates, where you look at function. Because it might be that what's going on in that neck area isn't directly about the neck. It could be that maybe your shoulders aren't moving efficiently. And I do find, certainly through doing the Pilates, that a lot of women I'm dealing with, the shoulders aren't moving. They've got stuck. They're not sliding, gliding over the rib cage. They're kind of stuck to it. Now, if your shoulders aren't functioning, there's going to have to be movement elsewhere and consequences. So it could be in the lower back you'll have pain. It could be that the neck, because those areas are trying to deal with the fact that your shoulders aren't doing what they need to do. So it's really important to be very well, not very mobile, but to do mobility through the shoulders and to be mindful just what you're doing with your neck. And like in the office, if you're sitting down a lot and you're in that forward posture, that slump, that's not good for the neck, it's not good for the shoulders. So we need to be working into the mobility in that area so you can free it up. I find a lot of people's rhomboids, those muscles that help pull the shoulders back, aren't necessarily doing the function they're supposed to be doing. So shoulder mobility, very important. We do a lot of that in our Pilates class. But it was just tonight really to say that if there is that cracking sort of popping sound, doesn't necessarily mean there's a concern there, but you just need to be mindful of just what's going on in that area, and that maybe it is that sort of change in the synovial fluid pressure causing gaseous bubbles. It could be that the ligament, tendon, or sort of muscles are going over the bone as well. That can cause a sort of sensation of sound and kind of crunching going on. I mean, wear and tear will happen as we age, but anything with pain, well worth going to have it checked out. Any swelling, that's not a normal kind of function going on in the body. And if you're interested in more mobility through this area, through the neck and shoulders, feel free to get in touch. So just a quick one tonight. Hope you're having a good evening. Please feel free to like and share to anyone who you might find this is of interest to them. And I will be back on again tomorrow. Have a good evening. See you later.